Good afternoon, and thank you for joining me for another Leadership Rounds. I'm Dr. Melinda Estes, President and CEO of St. Luke's Health System in Kansas City and Board Chair of the American Hospital Association. This week, I'm pleased to introduce Dr. David Zaas, Chief Executive Officer for MUSC Health, the Charleston Division, and Chief Clinical Officer for MUSC Health in South Carolina. Welcome, David.
Thank you, Mindy. I'm glad to be here.
The Medical University of South Carolina educates and trains more than 3,000 students and nearly 800 residents in 6 colleges and has more than 17,000 employees. As a clinical health system, MUSC Health operates 8 hospitals comprising more than 1,600 beds, along with 100 outreach sites and nearly 275 telehealth locations. In his role, David oversees all clinical matters related to MUSC Health's 872-bed flagship medical center and the newly opened Children's Hospital. And as a board-certified pulmonologist, his insights on how we should be preparing for cold, flu, and COVID are of particular relevance. So David, thank you again for joining us, and let's just jump right in.
That sounds great.
You know, as we're heading back to school and with the fall season upon us, all of us in healthcare know what's right around the corner. And so I want to start by asking your thoughts and insights on what we can expect with this impending flu season. What do you think we'll see by way of severity, and what should hospitals and health systems be doing now to prepare?
Thank you, Minnie. This is really a unique time. I think we all know what to normally expect with flu season, and hospitals and health systems have done a great job historically of advocating within our community for vaccination, of preparing to keep our team members and our community safe. But we have the complexity this year of the uncertainty of how COVID will impact flu season. We have many concerns about the risks of potential co-infection of COVID and flu, either simultaneously or sequential. And what will be the impact on the severity of hospitalization? What will be the impact on our already strained healthcare resources that have been struggling with the waves of COVID over the last 6 months? For health, as a health system and an academic health system leading the efforts here in the state, there's a few things that we're focused on. The first is really getting out the messaging to our community about the importance of vaccination for flu, and then for COVID when that is available. The other is identifying safe ways to be able to test not only for COVID, but for flu and to other respiratory viruses, realizing that our testing strategies for respiratory viruses will likely need to be different due to the infectious risks of COVID. And then finally, really developing our inpatient capabilities, especially within the intensive care unit, for the concern that we face a significant increase in the morbidity and mortality of our respiratory viruses, and our concerns of likely increased numbers of hospitalizations and increased numbers of critically ill patients that will need our care across the state.
So what about organizational concerns? And I think you've alluded to a couple of those as we try to look beyond COVID. I mean, are there staffing, testing, or supply needs that we should be working to get ahead of as we move into this fall time period?
So I think we have needs in many of those areas, Mindy, and let me focus on just a few components. We know that our testing resources around the country have been strained due to COVID. As we approach both schools reopening, our community becoming impatient with some of our social distancing, and the respiratory virus season, we are predicting that we're going to have a significantly increased demand for testing. The lack of specificity of the clinical symptoms of COVID mean that as our community develops other respiratory viruses, we're going to need to be screening for COVID as well as these other viruses at the same time. So we are preparing to say, how do we ramp that up significantly with the constraints of our supply chain and our resources? We're also worried about our PPE and the importance of keeping our care team members safe as we deploy more testing sites, as we have more patients with respiratory symptoms, our run rates, our utilization of PPE, we know is going to go up. So I think it's important that we work together, both as hospitals, but also with our state and local government, to make sure that we have adequate supplies to really ramp up testing and to really prepare for the increased use of PPE in the winter months as we see our hospitalizations likely increase.
You know, it's interesting to me, as we have evolved in this pandemic and now come 6 months into it, the more things change, the more they have, and testing and PPE continue to be at the top of the list of what we need to pay attention to. From your clinical perspective, what best practices and protocols have you experienced or heard about around the practice of testing patients both for coronavirus and influenza? Should one go first? And will we be advised to treat one differently than the other?
So, Mindy, I think it's going to be important that when we think around testing as we get into flu season, we're going to need to have a way to likely be able to test for multiple respiratory pathogens in a single encounter. We're going to have our assays to be able to detect both flu as well as COVID, and for our immunocompromised patients, likely even a more extended range of respiratory viruses. We're experimenting with ways to say, how do we do testing differently? In addition to our drive-through sites, do we need to develop other mobile, portable sites to be able to test patients without bringing them into clinics in the setting of their respiratory viruses that we know they're going to have at the same time? I think in terms of treatment, we know at this point that our treatments are limited, especially for the majority of patients that have more mild to moderate symptoms, really focusing on supportive care and best practices. It will be important to understand what's the benefit of some of the newer treatments, especially for COVID. How do we apply them, and to which patients will we get the greatest benefit? And finally, I think it's important for our audience and everyone in our community to really stress the importance that we know that masking works. We know that social distancing and hand washing and all of our best practices to prevent COVID will hopefully also prevent flu and many of our other respiratory viruses. So while I understand the pressures around reopening and the desire to get all of our children back into schools, how can we reinforce the importance of when we do that, of following these best practices, right? We know here in the hospital, we can bring thousands of people onto our campus safely every day, but we're vigilant around masking and hand washing and distancing within our spaces, that I think we need to be able to ensure our best practices in all of our schools and throughout all of our community.
Good advice. Just a thought occurred to me. Can you have COVID and flu at the same time? Do we know?
So I'm going to speculate, Mindy, because I'm not sure that anyone knows, but I think it's going to be possible for patients to get both. I don't see any reason why we won't have some patients that have co-infection with both. I also worry that the lung injury potentially from flu could make someone more susceptible to a greater severity during a subsequent COVID infection. We know that a lot of our influenza patients get post-flu bacterial pneumonia that we've known throughout our training. And I think that that lung injury from a prior viral infection may create a higher severity of illness in the subsequent COVID infection. So knowing they're both going to be prevalent in our community at the same time is something that I know scares many of us. But at the same point, I think it encourages us to say, how do we prepare? Let's make sure that we are prepared to step up as these needs of our community. And at the same point, let's hope that the masking and best practices around hand hygiene actually make this a very mild flu season if we really ensure that we continue those practices.
Thank you. How important will it be for hospitals and health systems to engage with public health entities and other community providers? As we move into a new season with evolving issues, will we see these efforts coordinated in any way? And if so, toward what goal?
So many things that come out of COVID are actually going to be positive. I know we always focus on so many of the negative implications of COVID on our society and on our hospitals, but there is some good lessons that we've learned. I think we've seen better collaboration between hospitals and health systems within communities across the country and around the world than I've seen in more than 20 years of my career, prompted by COVID. I think COVID has also really enhanced collaboration between hospitals, local government, other nonprofits, and really helped align us around our mission. While we think traditionally of hospitals of the place to receive sick care, all hospitals and health systems, right, are transforming to try to be promoting health and wellness. And I think the challenges of COVID will make us stronger and make those relationships between how we work with public health, how we better share data, how we better collaborate on initiatives to keep people healthy, how we communicate better than we have before. So I think the stress and challenges of COVID will allow us to hopefully collaborate not only better this flu season, but through future pandemics and hopefully through our broader public health initiatives, where we know as hospitals we need to work with our public health agencies, with our local governments around socioeconomic determinants of health, around homelessness, around access to food and transportation, and all of these other key determinants of health that we probably are now going to be able to have a bigger impact on due to our improved communication and relationship outside of just the hospital.
Well, for every crisis, there is an opportunity, and I think you've just highlighted an important opportunity for us. You have shared a few messages for our community. I mean, masking works, hand washing, social distancing, but how can we, as we move into this fall and winter time frame, enlist our neighbors to become an active part of the solution?
I think it's important, especially in this unique time, that the practices that we need to do for COVID aren't selfish. All of our best practices are to really benefit our community. Our ability to follow these best practices, to, again, our vaccination, our flu vaccines, and eventually for COVID, our masking, our social distancing, our hand washing, these are opportunities to keep our neighbors safe, to keep our schools open, to keep our community businesses open in these challenging times, and obviously to keep our healthcare workers safe as we prevent our hospitals from being overwhelmed by some of these challenges. So I think it's a time for all of our communities and our neighbors to step up together to say, right, we are now being selfless. We're doing this for each other. And I think that impact is something that really, again, will be a benefit. When I look at the feedback around how are hospitals viewed by our community, in many ways, right, we are viewed now in a more positive light than we've been viewed in years. People realize the great work that is done in our hospitals and appreciate it now more than ever. And I think that will only grow as we work with our neighbors to focus not just on providing care when they're sick, but helping to keep our community healthier, and how it's a shared obligation for all of us to do this together. So I think it's a great time to be a leader in healthcare. And it's a great time to be a leader in the community, because there's a need for leadership to step up and to really help ensure that we work together as a community.
Well said. David, thank you again for joining me today and sharing your insights on how we can and should prepare to navigate the looming double pandemics of COVID-19 and the flu. I know your perspective as a healthcare leader and clinician will help many leaders as we head into this next challenging phase of 2020. Until next time, thank you everyone for joining me today. I hope you'll be back for our next Leadership Rounds conversation on October 8th, when we'll be discussing health equity issues with my guest, Dr. Kimberly Dawn Wisdom, who is not only Senior Vice President of Community Health and Equity at Henry Ford Health System in Detroit, but also Michigan's and the nation's first state-level Surgeon General. I'll be looking forward to that conversation and to having you join me for it. Until then, stay safe and be well.